Hi, everybody. I'm Dave Mensa. I'm going to take you through a quick product demonstration. Pretty much what we're going to do here is kind of show you the user experience while working within Epic. Now, typically what we like to do when we do these product demonstrations is we do like to kick it off with a little bit of a story. And so for clinicians, they do need to be efficient with Epic in order to deliver excellent point of care to their patients. And so when they do transition to a digital platform such as uPerform, it enables them to learn new concepts without them having to leave the floor. And it does also enable them to get reinforcement of learning or training that they've previously had in the past. Now, what we're going to do here is we're going to present this through the perspective of Howard Luke. So Howard is an ICU nurse who is assisting a physician, Dan Jones, who has just ordered some medication for his patient. And so Howard just now needs to document giving that medication to the patient. And so what uPerform does is enable Epic users in this case to get training or to find out information at time of need. So as an example, if Howard wanted to get the latest information on COVID from his leadership team, what he could do is he could click on a link within the main menu of Epic, and what that will do is it will route him to our platform, uPerform, and it's going to provide him a list of content and folders that's relevant to him based on an attribute about him from Epic. And so we're able to personalize content, so they only see the stuff that's relevant to them. And so if someone else, such as that physician, Dan, had clicked on that same link, he could get completely different content. So if Dan had clicked on it, he wouldn't see any content in regards to, say, nursing. But in this case for Howard, since he did want to get that COVID-19 information, he could just simply click on the COVID-19 folder, and it's going to give him that link to that up from leadership. Now, for any of this content that lives on our platform, he can simply follow it. So think of it like social media. When he clicks on that link, Howard will be able to get notifications as that content changes over time. It'll show up not only on this panel here for notifications, favorites, but it also can notify him via email. So he always will have the most up-to-date information on processes and initiatives as they change and evolve. Now you can kind of consider this link here kind of the top of the funnel. It's going to just give you access to all the content that's relevant to you. However, with uPerform, we can get much more specific than that. And we do that based on links that will direct you based on where you are literally within Epic. So in this scenario, let's say Howard decided to click on a link within the Storyboards area. If Howard clicks on that, uPerform is going to detect that he was in Storyboards, and it's going to recommend content that he should look at. In this case, it recommended 2 different tip sheets that he can review. Now, if Dan had did that same thing, Dan could have received completely different content compared to Howard, just based on their attributes from Epic. Now we're going to go ahead and come back here. But we can get even more specific than that. So we can even recommend just one specific type of content to review based on where you are in Epic. So let's come back here for a moment. Let's say we wanted to go within an activity. So if Howard was in flow sheets and clicked on the link there, we can detect that he's within flow sheets and recommend a specific document that he should look at. In this case, it's a tip sheet made with Microsoft Word, but it could have been anything. It could have been an Epic video. It could have been a PowerPoint presentation, you name it. We're going to go ahead and close. And then we'll talk about another scenario. So let's say, for example, that Howard's leadership wanted to give him updates or suggestions on new changes that have happened with HCC coding. They could do that via the Best Practice Advisory or the BPAs. And uPerform can integrate there as well. So in that scenario, Howard could have clicked on a link within a BPA, and when he does so, uPerform will detect that where he's coming from, and it will suggest the correct content to him. In this case, it gives him that HCC BPA tip sheet. And again, if somebody else, such as Dan, who's a physician, clicked on that link, he could get completely different content. So now that you kind of have a high-level kind of overview or understanding of how uPerform can assist users such as Howard as they are working directly within Epic, let's talk about another scenario. Let's say that Howard prefers to learn or gather information in a more traditional way within Epic. And usually that's done by going into the Learning Home dashboard. Well, uPerform can complement the Learning Home dashboard. And that's done by integrating into the various components within the Learning Home dashboard. So as an example, if Howard had went into the outpatient guides and e-learning component, if he clicked on these links, instead of being routed somewhere else, such as SharePoint and having to authenticate, he could actually be sent directly to uPerform seamlessly. And what he gets could be a variety of different outcomes. So for example, it could route him to a folder similar to what we saw earlier in the demonstration. It could take him to a specific piece of content for him to review. Or it can even do a contextual search, meaning that it looks at a certain value and recommends a list of content that he should review. So let's dive into that a little bit more. Let's say, for example, that Howard clicked on workflows. In that case, what it will do is it will recommend a specific piece of content that he should look at. In this case, this is a PowerPoint presentation that was migrated to our platform. Or if he had clicked on a link here for this post-upgrade e-learning, it will search a tag. It will find any content that has been explicitly tagged as post_upgrade by the training team, and it will recommend some content he should review. In this case, it gave him 2 different e-learning courses that he could look at. Just as an aside, Good Health, all the nurses are being cross-trained, so they are getting access to the inpatient provider training content. However, if that physician, such as Dan, had clicked on that link, that course would be the only thing he would see. He would not see this discharge overview course because it's in regards to nursing. I'm going to close out there for a moment. So now that you kind of have a better understanding, hopefully, of how uPerform can enable or train Howard at time of need while working with an Epic, let's say, for example, that Howard isn't in Epic at all. Can uPerform assist him then? And the answer is yes. That is facilitated by what we call the Learning Library. So we'll just come over here for a moment. So the Learning Library, it's available via the cloud, hosted by us, simple website that's accessible on any device. So if Howard is on his phone, if he's on a tablet, if he's even on his home PC, he can get here. And once he authenticates, he will be shown a list of projects that he can consume. Again, this is based on his attributes from Epic. So he may have more or less than other users that come into the platform. And when he gets here, he can either search for exactly what he's looking for. We do a search through content that you do bring in, so we can look through the data within it and suggest it to him. Or he can intuitively go into a project and find exactly what he's looking for. So in this scenario here, we're going to stick with Epic. So if he wanted to come in and review a discharge overview course, he can find it right here in his list of what's been suggested to him, launch the course, and he's on his way.